Dr. Nick MacArthur, and this is part 3 in a series of frequently asked questions on numbness. Now, in our last video, we talked about how numbness is due to a lack of impulses or a decrease in impulses coming from a part of the brain called the cerebellum. Now, in this segment, I'm going to show you some simple tests that you can do all on your own that will determine if your cerebellum is actually malfunctioning and causing your numbness. The first one, you want to have an open area where you won't bump into anything. You're going to close your eyes and then you're going to walk heel to toe. Just like this. Now, while you're walking heel to toe, you want to pay attention to whether you sway or wobble or lean or fall to one side. And if you do, that means you've got a problem. Okay, on this test, what you're going to do is you're going to bring your hands up so where your elbows are above your shoulders, and you're going to quickly, or as fast as you can, open and close your hands. Just like this. And you're going to go for about 30 seconds, a minimum of 30 seconds. And what you're going to pay attention to is whether one hand fatigues, tires out, becomes painful, or you're just simply unable to do it on one side. And compare which side is more significant or more severe than the other. If you're able to do that for 30 seconds without any problem, you're okay. But if one or both fatigue, tire out, or you become unable to do it, you've got a problem. Okay, now on this test what you're going to do is you're going to bring your right index finger up above your head, just like this. You're going to bend your head backwards to look at your finger, close your eyes, and then you're going to bring the tip of the left to meet the tip of the right. Now what's going to happen is, if there's no problem, you're going to be able to bring your fingers together just fine. If there is a problem, what will happen is as you get up here, you're going to start searching, and then you'll find it, or you'll bring it up and overshoot, or you'll bring it up and miss entirely. So if you're able to bring them together just fine, that's great, no problem. If you do any of those three things where they're searching, overshooting, or missing entirely, you've got a problem. And you want to do that on both sides. So left to meet the right and right to meet the left. And notice which one was more significant or more severe. Now, if you noticed any problems while doing these tests, you know you've got a malfunction in your brain and in your nerves that's causing your numbness. So, should you be taking medication for your numbness? We'll cover that in the next video.